Our next speakers are from the University of Colorado, Anschutz School of Medicine campus. As Director of Planning at CU's Anschutz School of Medicine, Suzann Staal provides guidance and oversight of approximately 1.4 million assignable square feet for the School of Medicine, with a primary focus on research and office space. She's responsible for project oversight, space utilization, and strategic planning. Suzann joined CU Anschutz in June of 2012 as a project manager with facilities management. She's joined by Ethan Carter. He joined the University of Colorado, Denver, and Anschutz School of Medicine in October 2010, and he's Director of Environmental Health and Safety, overseeing a department of 30 professionals across 5 divisions. Prior to that, he served in the U.S. Army and was an associate professor in the CU Department of Medicine. So Shannon and Michael, take it away. Or sorry, Shannon and Ethan, take it away.
Hi, good afternoon, everybody. Thank you. I'm going to cover the first bit of content here and then hand it off to Suzann to take us home. So while the focus of this project was not necessarily sustainability, a very positive outcome, as you'll see, is one of the biggest things you could do to promote sustainability is to actually not build a building. And that's basically what you'll see that we ended up being able to achieve. In the background of this picture, you'll see some newer buildings on the left side. And those are the buildings that we're primarily talking about in this presentation. The older building in the center is the remnants of the Army Hospital, from the Fitzsimmons Army Hospital. There's no research in that, but I'm sitting in that building today. So let's go ahead to the next slide, Suzann. So this overview in the red circles shows those newer buildings that we're talking about today, 5 of them primarily. We're kind of fortunate that this campus is relatively new to the University of Colorado. The Army left this space at the end of the 1990s and into the early 2000s. And the university was in an older location near downtown Denver. So there was the opportunity to basically move the entire campus, the Health Science Center at the time, out to this location with lots of land. And so buildings were built from scratch, and almost everything that we have is new or newer. Joining us out here when we moved into 2005, 6, 7, 8, 9, 10 timeframe was the University of Colorado Hospital, which is kind of in the pink color. Children's Hospital came and joined us. They were downtown in old facilities as well. They have a wonderful facility. And then the VA is off to the east, off to the right side of the slide there. So primarily, as I said, we're talking about the research buildings that are circled in red, and we can go to the next one, Suzann. So this schematic here shows the general layout of the research buildings, the floors on the research buildings that we're talking about here. As I said, everything was constructed basically in the last 15 years. And we're focused on basically the 33 floors in these different research towers, which range from 4 or 5 floors to 12 floors, I think. So there's 33 floors that are configured similarly, that all have active research going on. And the schematic on the right side, most of the floors are configured the same, where there's an office side on the right side here. And then there's badged access into the research side, which has various procedure rooms, which are kind of in the middle of the slide. And then a long corridor that goes the entire length of the floor, which is the linear equipment space or linear equipment room. And that's where mostly freezers and large equipment and other types of things. And then on the left side is the actual research bays, similar to what you saw in the first presentation on some of those schematics of the first presentation this afternoon. We'll get to it in a second. We'll have a blow up of that. But some people are maybe into air handling and that type of thing of engineering, but the air handling was purpose built. So the office side has some recirculated air from the office environment. The lab side is all single pass with fresh air and then evacuated out with through the roofs of the buildings. And then overall, the lab side of a given floor is relatively negative to the office side, so that odors and other types of things generated during research are kept in the lab environment. Initially, when these buildings were built, there was a relatively high air change per hour, ACH. And over time, we've realized we could save a lot of energy and a lot of money by reducing and having occupancy sensor, and reducing air changes and things like that. But one thing that kind of developed over these last 10 years is that this open bay configuration has led to clutter, poorly used space, and when we moved over in these 10 years, a lot of people just brought all their junk from the old campus and just dumped it into their existing space. You can see here a blow up of a given lab bay, where it's a standard lab bay with benches on each side, and then adjacent towards the center of the slide, there's an alcove where there might be biosafety cabinets and fume hoods and that type of thing. The linear equipment hallway is there, and then there's other procedure rooms. So in total, we're talking about over 400 principal investigators, all kind of funded and have their own research activities going on in all of these 33 floors. And it's a total of well over 500,000 of basically wet research space that we're talking about in these different buildings, and the building abbreviations are listed there in the middle of the slide. There's some core services, which is basically lab space, but for core activities. And then there's a vivarium and so forth. A module there is listed at about 700 square feet, designed to handle maybe 6 to 8 people at the high end. Procedure rooms over on the other part of the slide are shared typically and maybe 200 square feet. And then you can see the amount of space kind of average per investigator, maybe 1,200 or so. So as we said, as we spend our time walking through the building, Suzann and I and others, you start to notice over time an extensive amount of clutter and space that's used questionably in this type of thing. The model for assigning space going back to 2015 was basically a grant funding model of total grant funding per research lab of square feet. And it was a way to ensure that space was perhaps being assigned fairly based on research productivity. But it was handled at the department level and not the PI level. And what we tended to notice was departments maybe said they didn't have enough space, or there was some discrepancy about how much space they had, because the numbers weren't matching, the research productivity numbers weren't matching what we were actually seeing. And Suzann's a member of a group in the American Association of Medical Colleges, AAMC. It's a group on institutional planning, and they discuss these types of issues and space utilization extensively. And fortunately, Indiana University, the School of Medicine there, embarked on a project looking at space utilization, decluttering, and so forth. And so Suzann and others kind of optimized what Indiana did and tried to put that in place for us beginning like in 2021 and into 2022. And that's kind of the time frame we're talking about a couple of years ago. And I would say, as I mentioned at the top, some research work, units were saying we don't have enough space, or we can't recruit effectively because we don't have room. And there was even discussion of building a new research building and these types of things. So it was really imperative that the school looked very closely at how space was being assigned and how it was being utilized. So what we did, this ambitious project, was first there was some front end work to confirm lab assignments by unit and by investigator, by principal investigator, and then look at the grant portfolio of each investigator and see kind of what space they were assigned. And some of those metrics are there on the top. Then we formed a couple of teams that had School of Medicine leadership, people from like my department, environmental health and safety, facilities personnel, and the research affairs personnel. And we formed these two teams with the idea is that we would walk all 33 floors and take a look at what actually is going on, and then make a lot of notes about this space, and then end up ranking them with a ranking scale of 0 to 1, which is, you can see there in red, it's being used as storage, clutter, vacant space, that type of thing. And then going up where there was space that was somewhat being used, but was perhaps underutilized. And maybe a researcher had maybe too much space for their current portfolio. And then we had, 4s and into 5s, which was utilized. And then we did actually find, and when we knew this was going to happen, very crowded space that was highly productive, but they didn't have enough space. So that was kind of what the goal was. And then on the next slide, you'll see that we developed this. It's too small to see the details, but we developed a sheet where we recorded our observations, Team A walked 17 of the 33 floors. Team B walked 16, and then both teams walked 4 of the floors because they needed a little extra love and care, and they were a little more dicey, perhaps. And so we wanted everybody to walk through those spaces. The walks were completed on different days and at different times. We tried to be fair. We didn't walk a space on Friday afternoon at 5 o'clock and that type of thing. We tried to be there when there would be representative example of research activity and research productivity. The floors and the work units were not notified because we didn't want that everybody crowding in there and making their lab look perhaps more productive than it might be. And a given team, Team A or Team B, we all walked together at the same time and kind of fanned out and walked out and made notes. And then we met afterwards and compared and kind of did our rankings and kind of compared what we thought, what our observations were, and made notes and looked at some immediate action items, but also, kind of that activity level that was going on in a given floor and in a given research bay and so forth. And then Suzann and others from the dean's office met with the units and talked about what our observations were and allowed them to be part of the process, so to speak. And so go ahead and I have a few examples of kind of what we saw in a lot of the spaces to show you what that 0 to 1 and what the clutter is. So here on the left side is a lab that had a few things laid out there, but there was no evidence of, a lot of active research going on. We found a lot of examples in the middle there of just storage, research benches, tables, and on the right there, the tables are upside down and stacked on top of the bench. Clearly, no activity going on in those spaces whatsoever. Here's the extreme side on the other side where it was used for junk storage. Old computers on the left, boxes and files and things there in the center, more boxes and supplies and junk and empty boxes and things like that. This was common, right? And a research unit might be saying, we don't have enough space. And then they have this going on in several of their research bays. Old equipment that's dead, Christmas decorations. There's a Santa or a Nutcracker there. Old equipment is stacked and unused, and more supplies of pipette tips, bulk purchased and things like that. And then lots and lots of freezers that hadn't been, the researchers were gone. There was many cases where, in some cases, researchers had passed away and their space hadn't even been touched. Refrigeration freezer units that clearly aren't even usable, moldy boxes and cold rooms down in the bottom, down there on the right, samples. All those pails are samples, I think, like brain samples, I think, and other types of specimens, all laid out. So we went through this in a 5-week period, making all of our notes and taking pictures and documenting everything that we saw. And I think from here, Suzann's going to take over then and take us through some of the findings and then the outcome and the actions afterwards.
Thank you, Ethan. Okay, so the two teams, we finished our walkthroughs like Ethan just went through, and then it was kind of our team in the dean's office to figure out what our next steps were going to be from the findings that we found. So some of the major highlights that we discovered throughout this process was that we were not research space constrained. There were definitely opportunities to better utilize the space. And now that we had some metrics, we could really share that with the department leadership, and the dean was a huge component and advocate for this project. So that was huge for the success of this project as well. And then we really needed to better collaborate between the dean's office and the research communities about the ownership of this, and to help guide some of those processes and help get some information out there for those who really didn't know how to start a cleanup effort, or what to do in an X, Y, or Z process for green tagging or whatnot. And then really, how we collaborate with our campus partners. So as Ethan mentioned, our teams consisted of a wide range of university partnerships that we have, EH&S facilities, asset management, and others on campus. So this was really great also to get some of those individuals and those groups in front of the lab community to introduce them and have them engaged in this process as well. And on the right, we have some unexpected findings. I want to highlight a few. I think a lot of this stems at the realization is, as we were walking through the labs, how many lab staff would come up to us and say, hey, we have issue X, Y, and Z. but we don't know where to start. We don't know who to go to. We have lighting or electrical or mechanical issues or chemical storage issues. So really, we needed to understand how we could better support the lab community. So that was a big takeaway from this as well. Also, the quantities of disposal items. So we really needed to look at what our disposal process was for information getting out to the labs as well. We did initiate some work orders in real time as we were walking through the space. So here you can see electrical and plumbing issues. So there were some that we addressed in real time as we were walking through there, just to make sure that we were responding to those concerns that the labs had. Future needs. So we had a lot of consumables, and this was at a time when supply chain was still a little bit more of a concern. So there was a lot of consumable storage that was in the lab space. That's definitely gotten a little bit better, but that was a huge component of this lab cleanup, which we'll get to in a second. And let me go to the next slide here. So these are the findings of the scoring. So this still splits out into the 3 different categories of basic, clinical, and center, how we kind of bucketed the space. But in just our 3 main research towers, we identified approximately 44,000 square feet in that 0 to 1 category that Ethan talked about a minute ago. So how that translates, of course, is, we think about, can we better utilize the space that we have, or do we need to build another building? So if we take that 44,000 in today's dollars, which is about $1,000 a square foot for construction right now for lab space, we're looking at a cost avoidance of over $40 million, considering this component. And then with the average amount of space that we had per PI at that time, we were able to say we can accommodate approximately 35 new PIs into this footprint that we've identified through this process. So that's a huge takeaway from the exercise that we did here. So then it's like, okay, now we have all this data. We know what our findings are. What do we do? How do we actually action and get this space cleaned up, vacated, and ready for those new recruitments? So the process, as I mentioned before, the dean was really behind this, and he really wanted us to finish it kind of before the fiscal year. And so we started the cleanup process in March, and we really did this in a 3-ish month process, which was a huge campus coordination effort. And we could not have done it without our campus partners, including Ethan's team. It was a huge effort from everyone. So our team in the dean's office led this coordination of the actual cleanup with those partnerships. And so we met with every single floor, all of the different units on each floor. We had an additional 91 scheduled walks after the lab scoring walks to meet with everyone to talk through what the process was going to be for this cleanup effort, and to identify all the different categories that we were going to be looking at. So that included equipment, technology, chemicals, trash, recycling, shred it, equipment that was no longer needed, but still in good working condition, which was really a big takeaway for us, which I'll talk about in a little bit. And then what we did is after everyone went through this process, we went floor by floor, we staged and we removed everything. And then when the floor was done, we would have our custodial team come in and wax the floor. So that was kind of, it finalized that floor's project and process. And I don't know if any of you have this issue, but the waxing of those spaces definitely doesn't happen as regularly as we'd hope it would. So it was really kind of stamping the end of that project for that floor. So these are some compiled numbers from our disposal of the whole project. So on the top left, you can see some trash and recycling and shredded material numbers there. On the bottom left, we have our e-waste. I'll have some photos to show you in a second of our staging. That was one of the biggest, I think, unknowns that going into this is the amount of dead computers that were just stacked and piled throughout the labs. So that was really an unexpected finding when we went through this. And then all the chemicals. So, we'd have labs that would shut down and leave, and all those chemicals would stay behind. So a lot of expired, a lot of unused. We did repurpose some of these to other labs, but we did kind of one large chemical recycling at the end of the project. And these are some of those numbers here. So this is some of the staging of the e-waste. We brought in some Connex to help with our staging to move items out of the research buildings and then into the Connex before they were being disposed or recycled. So these are some of the photos of just the e-waste from that project. And these are some photos of lab space that was used for the staging. So mostly the green tagging or those items that were ready to be disposed of. You can see these are active research spaces that a lot of these, including the second one from the left, that's what it looked like before we came in. So this was definitely space that was not well utilized before this project. And then we also collected a lot of those consumables that I mentioned earlier. So, you know, labs would purchase in bulk and realize that they really didn't need it, or by the time they got through it, it would be years. So they donated in a sense to the dean's office in the School of Medicine. And we collected all of these items that we can then redistribute to other labs across the campus who may be in need of those. So I'll talk about that again in a minute, but and a lot of furniture, like extra lab shelves that were just stacked up in the lab spaces. So we also collected all of those, and we have them available when people need them in their spaces. So then the ongoing impact. So after the lab cleanup, these are some before and after photos of the spaces that we looked at. So as Ethan mentioned before, so the space on the left, it has a lot of boxes, a lot of equipment that's being stored. And then on the right, it is now clean, empty, and ready for a new recruit to come in and start their research. Same thing with this space here. And then this is one of those procedure rooms. And now obviously active research is happening in the photo on the right. And those at the end of each bay are the lab carrels. So this is where the lab staff can work. And this also freed up offices. So we try to assign offices to faculty and the PIs, and the lab staff works out of these lab bays. So this really helped also the office component of the lab floor. So since we did complete this around June of 2022, and ever since then, we still have projects that are in response to this. So a few to highlight, during kind of the beginning to middle of the actual cleanup process, we really realized that we had a gap in our team in the dean's office. So my background's in architecture, and then we have my boss who's a cardiologist. But we really didn't have anyone on our team that spoke the lab language and the research language for those like day-to-day interactions. So we created a lab and facilities coordinator position kind of at the tail end of our lab cleanup project. And we hired Cody Rester, who came from the labs. He has a science background and was a PRA for many years. So he is now an amazing resource for our team, and he really lives in the lab community, and everyone's getting to know him, and he's really helped kind of bridge that gap in communication between the labs and the facilities and planning space component of what we do. And then the reuse and reassign. So I'll have another slide on this in a minute, but we were shocked by the amount of equipment that was not being used but was still usable. And so we started to collect that and come up with an idea about how we can repurpose that across the campus community and try to recycle and reuse those components. We also updated our research space guidelines in December of last year. So we are actively rolling those out and trying to reestablish our metrics around how space is assigned across campus. And we also, we found a lot of clinical coordinators that were housed and living in lab space. So we're looking at how we can relocate their administrative home out of the lab so that we can better utilize that research space. And then lab signage. So it was hard to tell exactly who was where when we were walking through the lab. So that kicked off another project for us is better signage and wayfinding in those lab spaces. And then on the bottom right, that's a central lab supply, which I mentioned a minute ago. So after Cody came on board, we worked together. We compiled all of these consumables, all this equipment, and then decided to make a website for the campus community. So as part of this project, we collected about 4,000 items for reuse. And this webpage is now active, and that number continues to increase because now the campus community is familiar with it. So as they have labs that are leaving, they reach out to Cody and give him items that are available for reassignment on the campus. So that number is definitely increasing on a weekly basis. So he's created this website, which is incredible. It's like you go on Marketplace or Amazon and go shopping. But he has it filterable on the right, so you can search for consumables, glassware, equipment, fridges, freezers, minus 80s we have on there, and you select what you want and it sends him a message, and then he will coordinate that delivery to the lab. So this has been a great resource for a lot of our junior faculty who come in, who don't have any grants yet and want to get their lab up and running. So this was really something that we're proud of and has really grown since we initiated it. And those are all of our slides.